Is cholesterol medicine bad for you? Hello, everyone. Doctors often prescribe cholesterol medication, especially statins, to help lower cholesterol levels in the blood and prevent complications such as heart attacks or strokes. But have you ever wondered, does using this medication harm your health? And does it affect both good and bad cholesterol? Today, let's explore the truth about the benefits and risks of cholesterol medication together. 1. Benefits of cholesterol medication. First, let's talk about the benefits that cholesterol-lowering medication provides. These medications significantly reduce bad cholesterol, LDL, in the blood, slowing the progression of atherosclerosis. For people at high risk or those who already have cardiovascular disease, they help prevent serious complications such as heart attacks and strokes. Additionally, these drugs enhance the overall control of cholesterol levels, supporting better heart health. However, an important point to note is that cholesterol-lowering medication cannot differentiate between bad cholesterol, LDL, and good cholesterol, HDL. This means that when you use these medications, they reduce both types of cholesterol. This is why it's crucial to use them cautiously and combine them with a healthy lifestyle to increase good cholesterol, HDL, naturally. 2. Is cholesterol medicine bad for you? Although cholesterol-lowering medication offers many benefits, not everyone is free from risks. Some potential side effects include muscle pain and weakness. This is the most common symptom, especially with statin drugs. Liver damage, rare but possible, particularly if you have pre-existing liver conditions. Increased blood sugar levels. Some individuals may have a higher risk of developing type 2 diabetes when using the medication long-term. Digestive issues, such as nausea, bloating, or mild stomach discomfort. Kidney damage, sporadic, and typically occurs only with high doses or in individuals with severe underlying conditions. There's no need to worry excessively, as most users do not experience severe side effects. 3. Who should be cautious? When using cholesterol medication, cholesterol-lowering medication is not suitable for everyone. Certain groups of people need to exercise extra caution, including individuals with liver or kidney issues, pregnant or breastfeeding women, older adults, or those with a history of diabetes. This is why it's essential to have a thorough consultation and evaluation by a doctor before starting cholesterol medication. 4. How to use cholesterol medication effectively and safely. Follow your doctor's instructions. Never adjust the dosage on your own. Schedule regular health checkups. Monitor your liver and kidney functions and your cholesterol levels regularly. Adopt a healthy lifestyle. Include more fiber in your diet, limit unhealthy fats, stay active, and exercise regularly. It's essential to focus on increasing good cholesterol, HDL, through diet and exercise, as cholesterol-lowering medication cannot differentiate between good and bad cholesterol. While using these medications, pay extra attention to your lifestyle to maintain a healthy balance of cholesterol levels in your body. Cholesterol medication offers many benefits, especially in reducing the risk of cardiovascular diseases. However, it can lower both good cholesterol, HDL, and bad cholesterol, LDL. So it's essential to combine medication with a healthy lifestyle, and always consult your doctor for optimal results. If you found this video helpful, remember to subscribe to the channel and hit the notification bell to stay updated with more valuable health information. Thank you for watching, and see you in the following video.